Once a decision has been made for a cataract operation as the patient's solution, the patient has to return to the office after their initial visit, and we take very accurate measurements of their eye. This includes the length of their eye from the front part, the cornea, to the retina, so that the focus of the implant after surgery is very precise. We additionally have to take measurements of the curvature of their eye, looking for any irregularities that could influence the result and influence the choice of implants. The rest of the exam, of course, is reviewed to make sure there is nothing unusual or peculiar about the eye. We make sure that there are no other diseases, perhaps diabetic retinopathy, perhaps glaucoma, macular degeneration and the condition of the macula, which is the back part of the eye, and the retina has to be examined. The actual surgery, on the day that takes place, the patient's brought into the operating room and topical drops are put in their eye along with some medication to kind of relax them. The patient has some drapes put over their head and a device is put in the eye to keep the eye open. An ultrasonic device is put in through a microscopic incision. The cataract material itself is emulsified into tiny, tiny microscopic fragments and sucked out of the eye very gently. The implant is then put into the eye. We see that everything is positioned exactly as it should be. The wound self-seals, and that really is all that's involved. We watch the patient for about 15 minutes to a half hour, depending on each individual's medical condition. They take some eye drops post-operatively and are driven home. Post-operatively, the limitations after cataract surgery are very minor and very few, as opposed to the way they used to be with our parents, where they couldn't lift anything and their activity was very limited, for a week or two. In this day and age, the incision is so small and the measurements are so precise and the implants, are so advanced that the patients, for the most part, will have 80% of their vision back the day after surgery, the morning after surgery actually, and then through that day, most of the rest of their vision will return and they'll be visually functioning within the first 24 to 48 hours. Physical activity is minimally limited. I always kind of, joke with my patients that I don't want them bungee jumping and I don't want them skydiving. But of course, that's kind of to the extreme, and it's making a point that most physical activity, is really okay. One of the most exciting innovations that's going on right now in the field of cataract surgery are what is being termed premium implants. By this, they essentially mean bifocal implants, implants that make you see both at distance and near. They accomplish this in one of two manners. There's a group of implants that is termed multifocal, where there are multiple focus points at distance and then graduated up to near. And then there's another class of implants that takes advantage of your own eye's physiologic mechanism of accommodation. It actually moves inside your eye. At this point in time, it's not really evident which of those situations is going to take over the field, or if one or the other isn't, because they both have their applications. There are certain situations where a multifocal implant is more appropriate, and another where an accommodative implant is more appropriate. And it's really between the doctor and the patient as to what is best. Some of them have different reading distances, and some of them are better in terms of the quality of the distance vision in relation to the reading.